Good morning. Hello, and welcome to Sigma Gamma Rho 22-minute chat sessions. My name is Dr. Camille White. Sigma Gamma Rho is proud to partner with the NIH All of Us research program for precision medicine. The program is a historic effort to gather data from 1 million persons from diverse backgrounds to accelerate research and improve health. The goal is to find ways to treat and prevent disease in our community. These sessions are meant to provide you with valuable information while navigating the COVID-19 health crisis. Today, I am pleased to have with me Soror Dana Bageon Williams. She's a nurse practitioner with 9 years of experience and is currently employed with the University of Louisville Physicians in a primary care practice. She has over 20 years of experience as a registered nurse, having worked in a variety of specialties. Dana is a passionate provider for her patients, providing quality care and education tailored to each patient's specific health concerns. As a New Orleans native, Dana graduated from Southern University at New Orleans with a BS in biology in 1998 and from Delgado Community College Charity School of Nursing in 2000, where she received her RN degree. She received her Master of Science in Nursing from the University of South Alabama in 2011, specializing in family nurse practitioner. She is currently working on her doctorate of nursing practice at the University of Alabama, Huntsville, and anticipates graduating in December 2021. She has been a member of Sigma Gamma Rho Sorority Incorporated since 1998 and is an active charter member of Mu Omega Sigma chapter in Fredericksburg, Virginia. Dana is a loving wife to Willie Williams, devoted mother of 2 children, Chris, 25, and Bayla, 19, and a Diddy to Nico, 2. In her spare time, she enjoys being active with the ministry at her church, working out, and traveling. Today, Dana will talk to us about COVID-19. Welcome, Soror.
Good morning, everyone. Thank you, Soror, for the introduction. So today I just want to talk to you just a little bit about COVID-19. As many of you are quite aware, we've been in this pandemic for quite some time now. I think we started hearing some reports about it in late December of 2019. Might have heard about it being in China, this rare illness, and quickly it spread across the globe. It became to the forefront of the United States probably at the end of February, beginning of March, when we started noticing that there were cases out in Washington State. But what is COVID-19? And how is it different from other traditional illnesses like the common flu and even pneumonia? Well, first of all, the COVID-19 virus is a virus, and it is spread through droplets of saliva or discharge from the nose when we cough, sneeze, and even when we talk. So even as we're talking, we are spreading droplets of saliva in the air. And if you have this virus in your saliva, you can infect somebody with it. So what differentiates COVID from, say, influenza A or B? Well, although people can die from influenza A and B, and it both are respiratory infections, COVID-19 seems to not only attack the respiratory symptom tracts, but the entire body. People have complications with their hearts, the livers, the kidneys, even their skin. That's how much this virus attacks the body. There are people who are more at risk of having more severe illness of COVID, and those with pre-existing conditions such as diabetes or cancer or COPD are at extreme risk for having more severe illness than those who do not have pre-existing conditions. So it's very important when we talk about COVID that we understand what are some of the symptoms. Typically, a person can present with a fever, a very high fever. When we're talking about a fever, we're talking about 101, 102, sometimes higher than that. But it also can be accompanied with nasal congestion, cough, shortness of breath, wheezing. Some rarer symptoms of COVID can be muscle aches, sore throat, diarrhea, loss of taste or smell. But even more rare, we'll find some people with a weird rash that we don't understand, or discoloration of the skin, where the skin turns like a purplish blue or black color. Those symptoms, although rare, can be classically identified separate from like the flu or traditional pneumonia. The COVID virus can cause a pneumonia in our lungs. So it makes it very difficult for people to breathe. They feel short of breath, they're coughing, they may be even gasping for air. And so when we talk about these types of symptoms, we need to talk about first, how do I detect if I have COVID and how can I prevent it? And so one of the things I would like to talk about, first of all, is can we prevent COVID? Absolutely, you can prevent getting COVID. First thing, limit your interactions with people. I cannot implore you enough how important social distancing is. At a minimum, 6 feet. Ideally, if you must be around people that you're not quite sure where they've been and who they've been in contact with, 10 feet or more is even better. That is a safe distance if somebody happens to sneeze by accident or cough by accident, preventing you from inhaling those droplets of the virus that they may have. Part of social distancing is also limiting your close contacts to those just within your household. So if it's a husband and wife and 2 children, that's your household, not your grandmother, not your cousin from around the corner, because you know those people in your household, where they're going and who they're interacting with. Once you start branching out to your extended family, you have no idea how much exposure they're having to other people that may have this virus.
That's true.
Another thing, I can't implore you, and every healthcare provider on this planet will tell you, the biggest way to prevent any disease, not just COVID-19, but any disease, is to wash your hands, and wash your hands frequently. We touch, on an average day, hundreds of even thousands of different surfaces. Your kitchen, your bathroom, your toilet, your face, your car door, your keys, your cell phone. All these things have bacteria and viruses on them that we cannot see, may not appear dirty, but may be contaminated. Wash your hands. After that, cover your nose and mouth. We talk about masks, and I'm going to kind of elaborate here. So I've seen some things. I even went to the CDC website, and they really talk about this. And this is so important. Part of wearing a mask is covering your nose and your mouth. All of this area has to be covered. If any of this is exposed, you're exposing yourself to COVID. When we talk about cloth masks specifically, they recommend a multiple layer mask, fabric mask. So it shouldn't just be like a single piece of cloth, or like sometimes I see people wear those, I guess, like scarf-like things to cover their face. And it's just a thin piece of material. You can almost see through it. That is not protecting you. That is not covering your nose and mouth. Those tiny droplets that could be dispersed from somebody speaking, sneezing, coughing, will easily be absorbed through that, and you can inhale it. So one of the new recommendations is double masking. Putting a surgical mask where it fits around the nose and around the chin, your chin and nose area, and then putting a cloth mask over that. That protects you. They're only recommending the N95s for healthcare providers, and the reason for that is because any healthcare provider that has an N95 respirator mask has been fitted. There are different sizes for different size faces, and the average public person does not know how to fit an N95 respirator mask. And every healthcare provider that I know gets routine fitting tests at least once a year. Because as we gain weight, lose weight, do things to our face to enhance our beauty, maybe may alter the shape of your face. And so we want to make sure that mask fits appropriately. So surgical masks are ideal for the public. Covering it over with a cloth mask on top of it provides an extra layer of protection. Wearing a mask just covering your mouth does not prevent you from getting COVID. Gentlemen, beards, facial hair can impact how your mask fits. So during this time of COVID, I highly recommend, I know you like these women like your beards, but trim them down so that your mask can fit more snugly around your face. That will also increase the protection on your face. Other thing you could do, avoid large crowds, and especially in enclosed areas. I cannot implore you, if you know Walmart is packed at 12 noon during the day, try to go at 6 o'clock in the morning or try to go at 10 o'clock at night. The less people that you can interact with in an area that's enclosed, the better off you will be. This is not the time to go clubbing. This is not the time to be traveling, ideally. This is not the time to, get together with your girls, your boys. I know everybody is tired of being home, but I cannot implore you to stay home as much as possible. If you must work outside of your home, go to your job, go home. Try to break up your interactions. Once you come home, if you're coming in contact with a bunch of people, make sure you wash your hands, shower, take your clothes off, and put those in a wash. All those bacteria, viruses, you could touch your face by accident. The other thing is, I tell people, try not to touch your face, to the eyes, the nose, the mouth, especially without washing your hands first. We touch, like I said, your cell phone. Your cell phone was on the surface that may have been in contact with COVID. You touch it, you touch your eyes and nose, and you could potentially be infecting yourself. So just be mindful of touching your face and wash your hands. Also, disinfecting and cleaning around you. So surfaces that you touch all day long. I wipe down my cell phone several times a day. I've noticed some new things on Amazon where you can buy these cell phone cleaners to try to rid of bacteria and viruses and stuff. I'm not quite sure how effective those are, but wiping your cell phone down with bleach wipes. I keep hand sanitizer in my car. So when I open my door, I touch my door handle. I touch the door. I try not to, but if I have to, as soon as I get in the car, before I touch my steering wheel, I put hand sanitizer on my hands so that when I'm touching surfaces in my car, I'm not potentially contaminating them. So say you've done all these safe things to prevent yourself from getting COVID, but somehow you feel like you're getting sick. You're fatigued, you're coughing, you're feeling short of breath, you lost your appetite. What should I do? Couple of things. Everybody's states, local municipalities have different ways to get testing. Call your local health department and find out where you can get testing. Most test sites are outdoors for a reason. The reason is to prevent the possible transmission of the virus in a closed area where people can, potentially inhale the droplets. So most test centers are outdoors. They're drive up. You're in your car. They swab your nose or your throat, if not both, and they test you. There are some tests that take more than 25 hours. Some of them have rapid testing. Rapid testing tends to not be as accurate as some of the PCR testing that takes longer, but you can get yourself tested. The other thing is to make sure you stay isolated until you know your test results and you know what's going on. And ideally, even if you happen to test negative, it does not mean that you don't have COVID. It may mean that there was not enough virus in your system at the time you got tested that would trigger the test as positive. So if you're sick and you're having any respiratory symptoms, cough, shortness of breath, nasal congestion, any of those things, it may be better for you to pretend as if you actually have COVID and isolate yourself for a minimum of 10 days or till your symptoms start to improve. If you do happen to have a positive test. But say you got tested because you thought you were getting a little tickle in your throat.
Mm-hmm.
It came back positive, but you really didn't develop any other symptoms. The CDC is recommending that you stay home or isolate for a minimum 10 days after you test positive. Once your symptoms are gone completely, then you can return to your traditional, still social distancing, wearing your mask, washing your hands if you must interact with people. If you happen to have COVID and get severe illness, and what I mean by severe illness, having to be hospitalized, having to be on some type of oxygenation, whether it be through a mask or even being intubated, it may be better after you've come home from the hospital that you isolate yourself for up to 20 days. The reason for that is because, one, your illness was more severe, so you're probably still shedding virus if you happen to be discharged after a few days after being in the hospital. Also, your symptoms may linger for a while afterwards. So ideally, we recommend these people isolating for up to 3 weeks after they've had a positive test, just because you could be shedding the virus longer than somebody that had no symptoms, for instance. And even if you don't have any symptoms of COVID, but you do have a positive test, you can spread COVID. In fact, most infections don't occur from somebody really being sick around another person. That most people are spreading it what we call asymptomatically, meaning that they don't know that they have the COVID virus, but they're out and about, they're not wearing their masks, they're not social distancing, and they're spreading this virus.
Yeah.
Okay. If you happen to be sick and you're unable to manage your symptoms at home with traditional over-the-counter medications, call your primary care provider. Do not show up at the doctor's office without having called first. Most primary care practices do not want you showing up with symptoms of COVID to the office and potentially infecting the staff and other patients. So call ahead. Most practices have telehealth, which is kind of what I'm doing right now, talking to you, is doing a telehealth visit via telephone or computer or tablet and discussing your symptoms and how you're feeling. And they may be able to prescribe some medications for shortness of breath, for possible pneumonia, and for your cough. If your symptoms are so severe that you can't get your breath, or you're just really struggling and feeling awful, go to the ER and just let them know. They will probably isolate you right away and test you right away. I do want to talk about what I learned more recently about COVID-19 after you've been infected, and it's actually called chronic COVID-19 syndrome, and this is happening to people who have tested positive and had symptoms and gotten over the initial illness. So their COVID tests are now negative. They were sick, they had severe illness, and they're now testing negative, but they still have no energy. They still have memory issues. They're still having muscle aches. They still have no taste or sense of smell. Some people develop, honestly, I've had people develop hypertension that didn't have it before because their kidneys failed or some other complication due to COVID. So people can have, we're learning so far that people can have these symptoms for up to 9 months. And the reason why we say up to is because we've just been tracking this for about 9 months now and seeing that these symptoms can last this long. It may last longer. We just haven't gotten that data yet. But we are seeing people that have gotten over their illness, otherwise may be better, but they still having these lingering symptoms. And we're still doing the research to understand why that might be happening.
This is really good information, and I appreciate you sharing it. I just want to ask the question, we're working with the NIH, All of Us research program. How can the information that you've shared be applied to clinical research and healthcare in the Black community?
Oh my goodness. So anytime I tell patients that they're having these symptoms, I actually tell them to journal them. So if you participate in all of us and we're able to get this information and we're able to see, well, hey, is there more Hispanics, let's just say, for instance, that may have more muscle aches more than, say, our African American or non-Hispanic white counterparts? What about, well, what are we having more kidney failure in African Americans? Are we having more residual? How long are their symptoms lasting? So being able to interact with the NIH and being able to track these different outcomes is really important to research, so we can see how the virus is affecting different communities in different ways.
That's great information. I really appreciate you being here, Soror. And in closing, we have a video from the National Institutes of Health All of Us Research Program on Precision Medicine. Thank you so much, Soror, for joining us.
Thank you. Thank you, everyone.
We are one nation, one people. When called upon to give from within, we come together and find that our capacity to help others is limitless. What lies inside all of us is more than data. It's life. It's more than insight and medical research. It's vision and honor and compassion. What's flowing through America's veins is its diversity. The next great breakthrough will be found in each and every one of us. And what we find there will unlock mysteries, heal the sick, and eradicate disease. We ask for 1 million individuals to come forward and stand on this landmark in history. All of us are different, and it's those very differences that will lead to answers for generations to come.